Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992. That's all I do is perform cosmetic or aesthetic plastic surgery. I perform a lot of Brazilian butt lifts, and people have all sorts of questions about aftercare with Brazilian butt lifts. And one of the major questions I get is, Dr. Shapiro, do I need to get some massages after this Brazilian butt lift? And the answer to your question is no. And in fact, you need to understand what a Brazilian butt lift is and why it is that we do what we do afterwards. Basically, a Brazilian butt lift is I'm taking fat from one area, usually the abdomen, the flanks, and the low back, and I'm purifying that fat and I'm re-injecting it in the buttocks area. That fat goes beneath the gluteus maximus muscle, into the muscle, and above the muscle to give you some volumetric expansion there to give you that three-dimensional voluptuousness that you're looking for. To maintain that integrity of the fat, we want that fat to get its own blood supply. And usually we say about 3 weeks or so, we want to maintain the least amount of motion in that area that could make the fat not get its own blood supply. So a massage, if you will, in the first 3 weeks or so in that area where I've injected the fat is really not a good thing. So we try to dissuade anybody from having massages in those areas. Now, the areas where the donor sites are, such as the abdomen and the flanks and the back, oftentimes I will have people get some lymphatic drainage of those areas to help maximize the reduction of swelling in those areas and help move things along. Now, you will have a garment that you wear anywhere between 3 and 6 weeks after the liposuction and fat transfer, and that will take care of a lot of it. But I think it's important to understand that you really don't want to touch that fat too much after the Brazilian butt lift. So you want to maintain less pressure on those areas by using a pillow in terms of sitting. You want to sleep on your stomach or on your sides, and you want to decrease any direct pressure points for an extended period of time. In that vein, you want to decrease any activity with regards to massaging directly of that fat because we want that fat to live, we want it to get its own blood supply, and we want things to stay put initially. Now, after 3 to 6 weeks, you can get massages in those areas. A lot of people like to feel as though that helps decrease any irregularities, but really in the first 3 weeks, you don't want to have massages on the buttocks. I think communication is key with us, so I want to give you a game plan in terms of understanding what areas you can have massage, what areas you want to stay away from, and we want to be clear on the onset what we're doing to make sure that that fat lives. So basically, the best way to get an idea whether you're a candidate for Brazilian butt lift, come in for a consultation. We'll talk about what the procedure is, what it is you're looking for, what it is I think I can provide for you, and of course, what it is I want you to do and not do after surgery so everything is clear and nothing untoward is done. Thank you very much.